Hello everyone, my name is Konstantin Koshechkin. I am Associate Professor of the Department of Information and Internet Technologies in Sechenov University, Moscow, Russian Federation. And I would like to introduce our vision of blockchain technology application in public healthcare. There is a lot of topics to discuss in this direction. First of all, main thing that should be told is that blockchain is not the same thing with Bitcoin. Actually, in my report, I will try to avoid subjects of cryptocurrencies as much as possible. Main idea of blockchain technology is in inclusion of cryptographically created hash codes of previous transaction groups, so-called blocks, in next ones. This idea with decentralization of database create capacity to protect transactions from changes. Once in block, they are forever protected by upper layers of blocks. Blockchain systems can be categorized according to who can read and send transactions and who can process them. At the beginning, blockchain systems were all about data exchange in decentralized systems. But with a limited number of nodes and users, this technology can be used for restricted access information exchange also. Main entities of blockchain systems are the following. Coins, which are as much similar to common money as possible and are used as a medium of exchange. Tokens are representation of some object or service in blockchain. Users can spend coins to buy tokens if they were created for sale and exchange tokens for services and objects. And the last one is smart contracts that are programs to be executed exactly as they are set up by the creators and are stored in blockchain. For example, it may require confirmation from all included sites to confirm the deal. Blockchain implementation show fastest spread speed in comparison with any previous technologies. Main branches of it are cryptocurrencies, tools for development, financial tools, measures to keep sensitive data in private, value exchange systems, data sharing, authentication, and others. This technology market is already pretty big and keep growing every day. It attracts investments, most qualified industry professionals, and promise to increase effectiveness and reduce costs. In 2018, two things are clear. Healthcare is ripe for changes, and there is a massive opportunity for blockchain technology to lead this transformation. Healthcare is a very complicated industry, and it requires not just one solution for all, but interoperable ecosystem of blockchain applications. One of them suitable for patients and doctors' authentication, others for electronic health record distribution. Separate solutions can be useful in pharmaceutical supply chain based on smart contracts. There is one common thing in majority of newly developed systems in healthcare based on blockchain. It's data gathering for clinical trials. It may be database creation for potential enrollment lists of the patients, or medicines usage data that allow to gather information about side effects or new potential indications. Pharmaceutical companies have major costs in drug development phase, and clinical trials are one of the most costly. Blockchain may help to decrease this spending on the one side and help patients to get their more effective treatment fast on the other side. Blockchain electronic health record is to provide conditional access for different healthcare agents, doctors, hospitals, laboratories, pharmacists, and others. All medical data is kept encrypted in a secure cloud data storage. Blockchain systems are to provide decryption on patient acceptance and to ensure new records are correct. The criteria of correctness are predetermined in smart contract. One of the biggest problems of healthcare nowadays is qualification of medical personnel. Medical errors cost a lot in measure of money and lives either. This is one of the reasons why standards of treatment are widely implementing. Maybe this is less personal approach, and in most cases it will take more steps and time to obtain suitable results. But it reduces chances for mistreatment in less common cases. Actually speaking, standard of treatment is not more than an algorithm. Blockchain smart contract can provide facilities to control and help to fulfill these standards. Decentralized data environment is one of the very good possibilities for mobile usage. It doesn't matter how far are you from your data storage or healthcare facility. You can access your medical data anywhere and even provide more useful data about your activity with help of wearable sensors that collect data about your health. Telemedicine is another emerging technology for healthcare, and blockchain can provide a lot of beneficial help in this area also. Patients and doctor identification, electronic health record distribution, safe data exchange, prescriptions, cross-border consulting, universal payment methods are one of the examples. Field of education in central focus for implementing of this technology because other areas of activity are closely connected to the education. It is future of our medicine, our science, and others. Despite the remarkable development in robotics, internet, and IT technologies, human resources are still the most precious one. And it's true almost for all areas of business. Blockchain can help prevent falsifying paper documents about education, and it will help employers to have easy and fast access for these documents to search for required specialists in a fast and truly objective way. Another field of interest is registries kept by official state bodies. According to state registries keeping, all listed resources are conducted in the way of the principles typical for classical databases. Reliability of information in them is gathered by duplication of primary entries based on paper. The control of changes is carried out by the means of the information system within which they are formed. Thus, the reliability of this information requires regular verification with paper originals. In most cases, paper extracts from these registries are required to confirm the presence of any information in it. As a means of optimizing the register model of storing legally significant information, creation of transactional database with public permissioned blockchain systems should be considered. On the other side, patient registries keeping can be widely improved by blockchain with the help of automation and data gathering by the decentralized blockchain electronic health records. Commonly, medicine granted and marketing authorization are published on specialized resources controlled by government agencies. There is no other way for public control of those registries but comparison with paper documents. Using blockchain technology allows full transparency of transactions. It should be public permissioned blockchain. Only authorized agencies may include new records in drug lists, but stakeholders may have access to read these transactions. One of the most promising projects on pharmaceutical market in the Russian Federation is marking of medicines with unique barcodes for each package. Blockchain is more than appropriate solution to store data about each package label. Actually, there is such a project in United States, which involve everyone from pharmaceutical companies to hospitals to record drug delivery on the blockchain. At each step of the distribution process, a network will affirm the provenance and authenticity of a drug shipment. Not only pharmaceutical products to customer distribution have opportunities to increase effectiveness by blockchain implementation, but whole life cycle of medical products and its managing includes severe and at the same time sensitive data exchange streams. Blockchain can provide inexpensive solution with high security capabilities for these processes. Accounts Chamber of the Russian Federation foretold that digital technologies will result in a reduction of number of clerks by 1/3. Automated and electronic mode for bureaucratic processes will result in reducing of control and supervisory activities by half. Other most qualified analytics in the area of economics agree that blockchain, artificial intelligence, process automation, and cloud technologies will be major factors in economy development worldwide. By introducing blockchain-based business intelligence, companies can benefit from reliable database on decentralized, encrypted, and non-editable ledgers, embracing the full potential of the technology in order to streamline and secure the data storage. Blockchain projects will provide huge amount of data that contain the full history of every transaction, all available for analysis. Big data ready for survey will appear in areas where no data exists before. From the beginning, blockchain projects are cross-border distribution data networks. In common sense, there is no borders in blockchain economy. For sure, it raises a lot of worry among state authorities. It will require some time to understand this technology as a tool for international integration and not a means for national interests. Blockchain is one of the most talked about technologies on the market on this decade. Eventually, a lot of weak spots were found in it. As everything new, these projects attract a lot of unqualified attention. So it's quite necessary to evaluate closely each project before joining it or using, and especially before investing money in it. One of our tasks in this field as experts in healthcare and digital technologies is to access such projects for public favor. Thank you.